I appreciate everybody coming today. This is a pleasure for us to see everybody out and really get some appreciation for what my staff does, what we do, what you do. Cardiovascular disease is unfortunately way too prevalent, and we all have felt it in this room, so including myself. I don't know if I shared this with you before, but I had a stent put in about 3 years ago. So I'm not necessarily a survivor like some of the people in this room, but I'm a survivor, and it makes me stronger to keep doing what we're doing. So we all have the problem of some sort, and it's just the way life is. It's a very common problem. The older we get, and now that the age of people, advancing, cardiovascular disease becomes much more prevalent as we all get older. So instead of dying at 30 from an infection because we didn't have penicillin, we live till we're 80 and have cardiac disease. So we're all here to celebrate that, talk about it, remember it in good ways, bad ways, but we're all here, and we're going to work through this. So, we came up with this idea, the Songs of the Heart, about 4 years ago, to try to celebrate this in a good way. We usually have 2 or 3 people give their songs, to tell their story about what they went through, and everybody here in this room that comes with a story, we understand that everybody has a story. We just try to mix it up every year and have 2 or 3 people share with us their experience. And I'm just appreciative of everybody that's here and the people that are going to share their stories. So I'm going to start with just going through some of I do this every year, but just some of the statistics about heart disease, just to get us all in perspective and say we're not all the weirdos out there, we're everybody out there. So cardiovascular disease is still the #1 cause of death in the U.S. 800,000 people a year die of cardiovascular disease just in the U.S. It's 1 in 3 deaths. That includes stroke and other vascular problems. Coronary disease, heart attacks, it's about 1 in 7 deaths. It's about half of all the cardiovascular death. 720,000 people in this country have new heart attacks every year, and about half of those have already had a heart attack in the past. So it's a huge, this keeps cutting in and out, doesn't it? Yes, no? I'll try to keep it close. I tend to do this. No. There's a heart attack every 40 seconds in this country. So we're not alone. It's every 40 seconds. We're trying to do something about that, but we're also trying to do something on the treatment side of it, and that's why we're all here. 115,000 deaths a year. Males a little younger, about 65, 66 years old. Females about 72 years old, not for heart attacks, but for deaths from heart attacks. There's a stroke every 40 seconds in this country. So huge, huge numbers. And when you think about that, just think about the EMS and everything that's going on around us. We're still a big county here, close to 90,000 people. And I'll tell you some numbers here in a second, I think brings that into perspective too. But we're pretty busy because we have people just like everywhere else. So smoking is a big problem. We know that. About 480,000 deaths per year just from smoking, and 43,000 deaths just from secondhand smoke. So not just necessarily cardiovascular disease, but that includes lung disease as well. So the good news is that the degree of the death rate has declined significantly over the years, and between 2004 and 2014 decreased by 35%. So pretty dramatic reduction in deaths. We have better ways to treat things. We have better ways to prevent things. Early action is crucial, and I think we've done a really nice job here with working with our emergency services and getting patients here, especially having the big one, in a much more appropriate time frame, and I'll go through that in just a second here. The other thing that's happened is AEDs, the defibrillators that are, I know there's one in this facility. There's one in most facilities that allow people to resuscitate people that have cardiac arrest, even if you have no experience in doing so. I sit in a place where I know how to do this because they have pads on them, and I have somebody pressing a button, and I just say, press the button. I had never had to do this before until a couple, 3 years ago, and I was scared to death. I didn't know what I was doing with an AED. I opened it up, I put it on the patient, and we used it. So it is something, it'll say on the side of the box, don't use this unless you're experienced. Put that aside. It's self-explanatory. It tells you what to do. You put the pads on. And then bystander CPR has been crucial too. So people knowing how to do CPR to get adequate help there if you don't have an AED present. We had a young person up at Allegheny College playing basketball this past week, 2 weeks ago, who dropped over in the middle of a pickup basketball game, 20 years old, and he got shocked back from an AED, and he's alive. So stuff happens, and there's people around that know what to do, and everybody in this room could do it. You just have to be able to read and listen. The thing tells you what to do. So early catheterization, I think, is important, especially with heart attacks. We know that a lot of the people in this room have had heart caths before. To me, they're pretty simple procedures. I've done about 15,000 myself. Dr. Friedel, who's here, has probably done close to that number himself. A lot of experience doing them. I think I did my first one, it'll be almost 28 years ago that I did my first heart cath. So we've been there, done it. We do lots of them here, and we're well versed in it. So, and then risk factor modification, that's up to all of us. We all picked the wrong families. If you have a family history, there's nothing you can do about that. That's the only thing we can't fix. Is family history. We can fix just about everything else. So here in Meadville, as you're aware, because most of you in this room have touched the people that are in the back here, I just want to give a thank you to the cardiac cath lab, I'll say cath lab staff, but it's cardiac care unit, which includes the cath lab, cardiac rehab, and all the testing that we do, all the people back there in the red, and the people in my office. I have 2 physician assistants. One's not here. She had the nerve of getting engaged this weekend and is in Nashville, and she couldn't make it. So, but I'd like to just give everybody a round of applause that helps out. And I think most everybody here that's been a patient has met almost everybody in the back of this room here, and they're just awesome people. You haven't met my wife necessarily or my stepson. You have today, but they're wonderful, and that's why I'm still here. And they're great helpers. So what we've done this past year, we've done almost 500 cardiac caths here in this hospital, which for the size of this hospital, it's pretty phenomenal. We're up to about 150 interventions, which means stents, balloon procedures, that sort of thing, which is remarkable. We're considered a high volume hospital if you're 200, and we're doing about 150. So for a hospital the size of this, we're doing incredibly well. We also have to watch that we're not doing things inappropriately, and we've once again reached the Platinum Award for the American Heart Association, and there's only a few more than 200 hospitals in the country who have met those qualifications to say we have the best standards, we have the best safety, the best outcomes among 230 hospitals, I think it is this year, in the United States. So when you see that Platinum Award, they've done away with the bronze. I guess they didn't like bronze anymore, so it's silver, gold, platinum. And a lot of you have platinum stents, by the way. They're platinum chromium stents, just so you know. I have one. So platinum's pretty cool. We've done, when I first started here, we did about 25 of the big heart attacks a year. This past year, we did 84. We've been out talking to EMS. We've gotten EMS to come to bring patients here because it's appropriate to bring them here. We have great track record. We have really fast times that we turn things around now. EMS, which I'll give 10,000 shouts out to because they're wonderful, doing EKGs out in the community and bringing people right to the cath lab. You don't have to waste an hour in the emergency room before you come to the cath lab. It's not always the case, but oftentimes it is the case. So door to balloon time, meaning the time you hit our door till the time we inflate a balloon and increase the flow down an artery and stop the heart attack, our goal is to do it in 90 minutes. We're at 48 minutes here. Okay, our average door to balloon time is 48 minutes. What's even more important, though, is the time of your first medical contact when EMS gets to you or somebody touches you in the medical profession first. Our goal is to be 120 minutes, and we're at 78 minutes here. So incredible amount of time that we save in improving patients' heart function because we have just incredible staff, we have incredible EMS, we have community that understands this stuff now, and we still could do a better job, but we're doing better than almost anybody out there. So I think we're doing a great job. And that's not me, that's everybody. So I'd just like to say that I think the process is working for us to improve care here. We've done it just exponentially over the last 6 years since I've been here. So incredibly, we've done over 31,000 echoes here in the last 10 or 11 years. So echocardiograms, people here have had them done. We don't do echoes on everybody, but when you think about the size of the county, it doesn't mean 31,000 patients have had echoes, but encounters over those 10 years. Stress testing is about 2,000 stress tests we did this past year. Cardiac rehab, almost 2,400 patient visits to cardiac rehab. So patients that have had heart attacks, does a tremendous job, I think, to get people back into the feeling of safety with exercise, knowing what they can and can't do. And we have a top-notch program for cardiac rehab, as well as our diagnostic testing program. So outside of the cath lab, which is where I live most of the time, I think we just do a phenomenal job. Dr. Flores, who's not here anymore, and I'm sorry to say that because he's a good friend of mine, and left for personal reasons back down towards Pittsburgh. He helped to really raise the bar in that world. Dr. Friedel, who you'll be hearing from here in a second, is a gentleman I've known for years. He was at Allegheny General when I was a teaching physician down there. We were in the same group for a while down in Pittsburgh, and he comes up here a couple, 3 days a month, or a couple, 3 days a week, actually, sorry, and fills in the gaps, not just in the cath lab, but does a lot of that non-invasive testing really at a high-notch level. So we handpick who we want here, who we have here, and I'm really, really happy that people are comfortable coming here. It's that whole notion, if you build it, they will come, patients and physicians, and I think that's what we're building here. So hopefully that's going to continue to be the case. So we're going to now just turn to having a couple people talk, if that's okay. We have some special people today. I'm going to have Alec come up first, if you don't mind. Interesting stories, not necessarily your straightforward stuff, but what we try to show here is that we can do a lot of stuff here. Some stuff has been done before. Some stuff has to be done after at other places. We know where to get patients to. We have ins and outs. Insurance is always a little bit of an issue and going to become a little more of an issue in July. But we still know where to send people, and we send them appropriately to places if we can't do the job here. But Alec will tell you we did at least the second part of his job here, and he'll share with us a little bit. So.
Good afternoon. Can you hear me well? Maybe not. Can you hear me well? Yes. Okay. For those who wonder why there are two mics, and I'm using this one and he's using this one, I think this is for the television filming. My name is Alec Chen, and I'm here to share my story. And when Dr. Wilson asked me to do so, I immediately knew that he is a very trustworthy person, not only because, and I'll talk more about that, but because of the stent and saving my life and so on, but he just basically says, talk and say whatever you want. Like, no limit. So let this be on record. I promise you, Dr. Wilson, I will keep this under 3 hours. He might be getting some dinners ready for us. I know he addressed this, but I personally want to do it now. And I'm pretty sure each one of us here, survivors, would echo the same sentiment. Just take a look at those wonderful ladies in the back in red. And many of them have just come up and said, I was there when you came in, and so on. And I've heard that not just today, several times under different occasions. And it's very hard for me to immediately thank them from the bottom of my heart and so on. But this is a wonderful opportunity with many of them standing here that obviously with Dr. Wilson and Dr. Friedel and Dr. Flores, really your work is not only not noticed enough, but when you do your work with such pleasant demeanor and as if it is something that you just do in terms of being you, this is very special and rare. And I just want to thank each one of you. Maybe not all of you were there, but I know all of you were somebody's. And you probably don't get the gratitude enough. So I would like to use this opportunity for all of us really to thank you. Well, in my case, there are 3 distinct chapters. If you want to listen to what might have happened in my life. 3 distinct chapters. I'll start with the first one chronologically. I was born with a hole in my heart. And the medical term for that is called tetralogy of Fallot. Fallot was a French doctor who apparently found out that when babies were born with a congenital hole, usually they had about 4 things wrong with the heart. So for those of you who know me personally, you might conclude right now to say, oh, you have many more than 4 things wrong with you. I probably agree with you. My wife will definitely agree with you. But the 4 things, I had 3 out of the 4. And so I had tetralogy of Fallot. Now in those days, it was not a really reliable surgery to open the heart and mend it. I was born in Hong Kong, and our family doctor told my parents, just hang on tight. Medicine really advances quickly. I will keep my eye on it, and when it is time, I'll let you know. So when I was about 10, he let my parents know, and they brought me to Houston, Texas Children's Hospital, and the Dr. Denton Cooley operated on my heart. So he mended the hole, and I went back to Hong Kong, and everybody immediately said, wow, you look really pink now. So apparently, before I had the hole mended, I was really sick a lot. And I don't have to dwell on those years. I do remember staying home from school because kids at school were sick. So my parents would keep me home because they said he will definitely get it. So I was able to daydream a lot being at home. And I'm the youngest of three, two much older sisters. They still are. I have never caught up in age. But anyway, so, I mean, they were wonderful sisters, but in terms of playing with a little boy, you know, a teenage daughter, teenage girl would not want to play too much with a little boy. I just realized my mic hasn't been correctly placed. Thank you for showing this, because now I can hear myself as well. So you missed everything. I won't start from the beginning. Relax. Watch the program. Yeah. So by the time I was, let's say, 14, my whole family moved to the United States, and I went to school and so on. But by the time I was in mid to late 20s, I found out I had something else wrong with my medical condition. It's called spherocytosis. Spherocytes are blood cells that are not biconcave, but they're sphere-like. And they tend to be less malleable. They're less flexible. So whenever your blood cells go past your spleen kills them. And so most spherocytes live for about 40 days, while normal red cells about 120. Now, if I'm beginning to sound medical, stop me, because that's about as deep as I'll go. So it's really neat to see that that tetralogy Fallot, I probably might not have survived at all without the open heart surgery. And then the spherocytosis is a second whammy. And the hematologist at the New York hospital told me that I have never seen someone with both tetralogy and spherocytosis. I said, come on, really? He said, well, they may have happened, but they died. So there's another medical reasons that I probably, as Dr. Wilson today said, shouldn't be here. So we're now moving forward. I had that fixed. I don't have a spleen, and I don't have a gallbladder. So I get infections probably easily. Now, during all that time, some of you might know I'm a concert pianist, and the music in my life played a great deal in terms of how I express. I don't express my feelings well at all, verbally. And so in my music, I find it very easy, very much at home. So I was beginning to enter competitions and so on. And there was one competition in Spain that I did not win, but a lot of hubbub was made of my playing, so they got me to come back to play. One of those trips that I was going to fly into Madrid, I heard and saw in the newspaper that there was a plane crash in Madrid. One plane was landing, one plane was taking off, and immediate fire combustions, no survivors. And then 2 weeks before that, identical scenarios, 2 Madrid airplane crashes. Now, during the competition, there were people who felt I should have placed higher. And in those days, my pride problem was, when they said that, I tend to believe them. So God was able to use that pride of mine to really associate with these plane crashes, because I was about to fly to Madrid 2-3 days later to the same airport. And so it was like, wow. So looking back, well, actually at that time I already knew, God was saying, you deal with your mortality now. You've had 2 strikes. So I became a Christian, and I received Jesus into my heart. Not because I wanted a ticket out of hell, although at that time I probably did. I have never really even read much about the Bible. But I realized that during that trip, what bothered me more than anything else was not because I might, quote, die, but I realized that whoever is going to die will probably die alone. I know many cases, family members and friends might have been at their bedside. I know that. But the actual dying, one does it him or herself. And so when I realized that God is working in my heart to realize that, hey, you know what? What will happen after you die? What happened to you? It is also because of that I realized I actually had a second hole in my heart. That hole was mended by Christ. That hole was to long to know about the eternity that I'll be spending. Fast forward again. So many times people do ask me to give testimonial concerts, so I would play and share my faith. They would know ahead that it is about the Christian faith. What I did, though, was, as I was doing that, I really began to realize, now, in general, I don't like to talk about myself at all. Today is different because everybody has his or her unique stories to tell, and I'm looking forward to hearing the others. But what is more importantly is this is part of a bigger picture. What happened to me, you might want to listen to, but what happened to you, what happened to him, what happened to her, it's all individualized. And so what happens is when you realize each one of us is unique, and to hear that life story, that heart story, it is very meaningful. So as I realized, fast forwarding some more, all of a sudden I had this heart attack. That was last year. It was 3 hours before I was going to play a concert. And that morning I actually went and there was a Steinway Concert Grand delivered from Cleveland. It was here. It was in the Iroquois Club. I actually went and met with the piano and started to practice on it. And in my case, I started having, about 10 in the morning, some gas bubble. It wasn't really pain per se, pressure, gas bubble. But gas bubble that you cannot burp out. I tried to burp and it did some, but it remained, okay? So I felt, wow, this is weird, you know. So I was practicing, and about 2 o'clock or so, all of a sudden I started having cold sweats. And I felt, this is not quite right. So I went and told my wife, and I said, can you look up on the internet what's it like with the heart attack? She goes, heart attack? I don't know what made me say that. To this day, I just, you know. So next thing I knew, she called my family doctor, Dr. Euler, his office, and his nurse, his secretary, Megan, said, why don't you come in and we'll do an EKG. So I came in, and as he started doing my EKG, it was the shortest EKG I've ever had. About 4 seconds. He started ripping all the wires out. He said, you're having a heart attack now. So next thing I knew, I was in his wheelchair. You know, his office is linked to the hospital, that hallway there. So, not hallway, whatever is that? What do you call that? Yeah, but you all know what I mean. It's connected. So he was wheeling me into the ER and shouting, you know, this is a STEMI alert and so on. And everybody, many of those people kicked right in, and they put a stent. And actually, during the procedure, I had several occasions, and I told Dr. Wilson this, all of a sudden from the waist down, I felt like I was electrified. Really hot, not pain, but it was just like that. So for some reason I started telling him because it was weird, you know. And he goes, breathe hard, breathe hard. So is it true that my heart, I had several of those. During those moments, actually, the heart rate plummeted. And he said, had I not been under that procedure, they would have lost me for sure. So, there are many strikes. If you play baseball, this is strike 7. So, obviously, he put a stent, and, I'm doing well. I've had the cardiac rehab, which also is excellent. The rehab is excellent. And so today, I'm sharing what actually transpired and happened. But I do need to conclude by telling you all that I'm now really waiting to see what God has in store for this chapter 3. He's writing it every day. But I think my attitude about being alive is different. It's hard to put into words. See, I told you I can't express my feelings. I kid with people too, when they say, wow, we're going to lose you. And you've heard this. You go to the pearl gate. Peter showed up and he said, what are you doing? It's not your time. So I had to look at my Google Calendar. I had to change it. The point is, we don't know when our time is in terms of moving on to eternity. But we do know what our time is every moment. And I'm also learning, having learned this a lot from Fred Rogers actually, giving others the moment when I spend time with them. And I think if I start to do that, I appreciate things more. That doesn't mean I won't appreciate spending eternity with God, but I'm here now. And so, and we are all saying that today by the fact that we're here. And I just want to end and conclude and thank you all for hearing this and for this opportunity to share. And I'm looking forward to hearing others after today. When I see you guys again, maybe we'll hear more. I just heard about what happened to that lady. Everybody, I guess, has her own symptom feelings. So just remember what they were like. It might happen again. So thank you, and again, thank you for this opportunity.
That's a remarkable story. A couple things I just want to reiterate is we don't see people with tetralogy of flow live long enough to have heart attacks. I'll be honest with you. And especially with all the other things that have happened. Denton Cooley was one of the first cardiac surgeons in the world doing open heart surgeries back in the 60s, which is when Alec had his surgery. He has since died. He's, in the last year or two, he was 90-some years old. But he and Dr. DeBakey were the two big surgeons in the world. They were both down in Texas. And he was just lucky to have the right time, the right window to live through this and to be repaired. And I won't say you're lucky to have a heart attack, but you're lucky to live long enough to have a heart attack. Let's put it that way. I told you should be dead, but you're not. So anyway, having said that, it's just kind of brings you back to what we do here. We do the average stuff. He comes in with a heart attack. We fix the heart attack. He had much the same problems that people have had here during heart attacks, where if you're in the cath lab, we have people who just like zip, zip, zip. Marion knows that well. And other people here of how quickly people work and get things done. So on to the next chapter. So thank you, Alec. I'm going to present just a brief story about the gentleman behind you, and if he wants to say a few words, he can. If he doesn't, it's fine. This was a different scenario altogether. And you'll have to remind me, Michael, if you had, you had known that you had problems with one of the valves in your heart, and had been followed for that. It's a congenital problem, again, congenital problem with the heart, not on the heart attack side, but on a narrowed valve, a valve that was basically born, instead of having 3 leaflets, had 2 leaflets. And wear and tear on the heart, I just read a statistic earlier this morning that the average person, your heart beats 3 billion times in your life. So imagine any machine around that will allow a valve to work for 3 billion motions without wearing out. But when you have a bicuspid valve, things can wear out much quicker, and you get narrowing to that valve. That's not what brought him in. We weren't really convinced he had a really tight valve until all of a sudden the electrical system, we have the plumbing and we have the electrical, okay? It's just like anywhere else. And I also read something today I thought was interesting, talking about the heart is like a house. It has 4 rooms, they're decorated differently, but the plumbing and the electrical are sort of hidden in there. And the doors are the valves, and basically what happened here was the electrical system went right alongside of one of those doors and was being pinched by the door, essentially, as that valve was narrowing. So this gentleman came in with basically in what's called cardiogenic shock, could not maintain a blood pressure. His heart had stopped communicating between the upper and the lower chamber, and typically that would just require a pacemaker. But this was out of the ordinary. It was more dramatic than what we would normally see. We whisked him over to the cath lab and put a temporary pacemaker in, thinking maybe he had an infection, something else dropping the blood pressure. Dr. Flores was here at the time. We did some urgent or emergent echocardiography on him and realized that the valve was actually much worse than what we had initially anticipated. And when the upper and the lower chamber stopped talking to each other, you didn't get that nice, smooth filling of the lower chamber of the heart. So we put an assist device in and ultimately transferred him out to get an emergency valve replacement. And I don't know if you want to say anything, yes, no, it's up to you. No, there's no pressure. There's no pressure. But he's sitting here. Yeah, it's the same crew, same people, same work. It's like every day, this is what happens here. And I think it was just one of those things where it was a bunch of different things that came together all at once, where we're all touching, different parts of the elephant, but we got enough people looking at the elephant, we got to figure it out. So I think it's wonderful. I saw him in the office, 2-3 weeks ago, maybe a month ago, and doing extremely well after your surgery. Had the valve replaced. Did not need a pacemaker, which is good. I know, I understand that. That's the least of your worries. The electrical system I can fix in 2 seconds. The plumbing sometimes gives us a challenge. So anyway, it's something that I think is, you have somebody sitting right in front of you that literally was dying on the cath lab table when he came in, and he's here and amongst all of us. So I just want to say I appreciate you allowing me to share your story with us. So. All right, I'm going to have Dr. Friedel come up. Some of you know Dr. Friedel. You may have seen him in the office. You may have seen him. He's been up here for a couple, 3 years probably, seeing people periodically, and he can tell us.
Thank you, Dr. Wilson. So just a couple of things I wanted to say. I'm probably going to echo a few of the remarks that Dr. Wilson made, but yeah, I have been here for about 3 years now. Been spending a lot more time here the past year, and I can honestly say that it's really been a joy to practice here in this community and the hospital. And that's not just saying something hokey. unfortunately, fewer physicians are really saying that these days, that they truly enjoy the practice of their specialty. And I think my colleague, Dr. Wilson, will agree. It's really something special that they've put together here at Meadville Hospital and with the cardiovascular program. I want to also echo, give a shout out to the staff that we work with, especially with the, all the staff, all the cardiac staff. The cardiac catheterization or cardiac cath lab team, just to give you guys an idea of what they do, they can be at home 2:30 in the morning and that beeper goes off. Within literally a half an hour, they are at the hospital set up to do a surgical procedure. And as I found out quickly, it's not always sunny with good driving conditions in Meadville, Pennsylvania. So, it's very hard these days to train and retain good staff, and they've done it here. They really have. And Dr. Wilson, I think, would agree with me that between the two of us, I think we've worked at just about every hospital in Western Pennsylvania, and this staff is on par or better than any staff that we've worked with. And so, anyways, when you're in the middle of the night and you're in, you get in a situation, it's really nice to have competent staff with you. And then finally, I just mentioned Dr. Wilson. A lot of you probably don't appreciate, who Dr. Wilson is outside of his practice here in Meadville, Pennsylvania, and so forth. I was a fellow at Allegheny General Hospital. Dr. Wilson was one of my mentors, and I had the privilege of working with him. We initially were in practice together. Our careers diverged a little bit. But I could tell you all about his pedigree and his resume and everything else, and his years at Duke and so forth. But here's the bottom line, just so everyone gets an appreciation of this. So the cardiology, there are a lot of cardiologists in the Pittsburgh area. We all get together at times at social functions and talk, but when we all talk about as cardiologists, when we have our heart attack or our heart problem, there's always a short list of who you want to do your procedures, okay? And Dr. Wilson is always at the top of that short list. And ironically, the second guy is the one that did his heart catheterization. So it's the bottom line is it's an honor to be working with him again. And again, he's, he really has put something special together here at Meadville Cardiology Program. I'm going to introduce our next patient. Oh, there he is in the back, Mr. Graham. And I just want to say just a few things just to introduce you to the audience and talk briefly about his case. First of all, Mr. Graham, salt of the earth individual, as are a lot of the patients that we treat here. It makes getting back to part of the reason why it's such a joy to practice medicine here. But Mr. Graham had a very rare, very unusual cardiac problem. He came in, and to sort of summarize, he had a few visits to the hospital, but to summarize, he came in essentially with a heart attack that occurred probably, we're guessing, a week to 2 weeks ago, okay, or before the day that he came in. And he was very, very sick. And as you probably all know, what happens with a heart attack, the blood flow to the heart gets blocked, and you end up with part of the heart tissue or part of the heart muscle that dies. Now, 99.9% of the time with medications or other procedures and so forth, ultimately that area forms scar tissue. It may not function well, but it forms scar tissue, and most people recover. In very, very rare instances, that weakened, scarred part of the heart muscle can rupture open. And that's what happened with Mr. Graham. This is something that you almost never survive. And just to give you an idea, Dr. Wilson has done more catheterizations and has seen more patients than I have. I've probably taken care of thousands and thousands of patients. I've had 3 of these in my career, and Mr. Graham's the only one that has survived. And he came to the office. He was very ill. We were able to identify it. We had an ultrasound. Chris is somewhere here. Where is Chris? Where is he? Is he hiding? I'll give a shout out. Chris did his echocardiogram, which allowed us to identify that the actual heart muscle had ruptured open. Fortunately, the heart is inside of a sac, And so he survived the initial rupture. So what we did, we placed something called the balloon pump inside. We placed it. It goes in through the femoral artery, and it sits in your aorta, and it's essentially that. It's a pump. It inflates and deflates, and essentially can reverse or at least stabilize shock related to the heart. We placed that, and we at that point flew him off to a center that could provide a surgical correction to that issue. And so actually it's even he initially was flown to Erie. They took care of him for a couple days, and then subsequently flew him to UPMC Presbyterian or Shadyside, excuse me, UPMC Shadyside, where he ultimately had a surgical repair of this. But anyway, that's the background. Mr. Graham, you want to come on up and give a few words?
Hello. I won't keep you long. I echo all of the sentiments that's been said up here before. And I'm glad Doc explained what happened, because to share a little bit of humor with you, if he was going to have me tell it, the first I knew what after they stabilized me, first helicopter ride up to Erie, when the surgeon looked at me there, he said to my wife, as she's begging him to operate on me, he said, "No, I'm not going to operate." He said, "I've never seen this much damage in the amount of time I've been doing surgery." I was laying there fully conscious. That didn't go down so well, but it was what it was. And as Dr. Friedel said, I spent about 2 days up there, and they sent me to Shadyside. But again, Dr. Friedel, I guess, explained what medically happened to me, because if it would have been up to me, I was told, well, you have a hole in your heart, your tricuspid valve quit, and the top artery's no good. But getting into the surgery part of things, that was another glitch. I know Dr. Friedel and Dr. Wilson know all the details, but I'm sure any of you that had the open heart surgery, I believe they give you a test to see your reaction to the heparin that's used in the operation. They send out two. The first one came back low positive. And I have enough medical knowledge, I guess, to figure, all right, I'm going to have a reaction to it, but I guess it'll be something low, or they can handle it. It didn't come to be that way. Dr. Gleason, who did all of my surgery, had me in there for 7 hours, came back to the room, told my wife, he said, "I've repaired everything." I was in recovery for about a little less than 2 hours, and my wife said that all the monitors and buzzers and whistles went off, and she says to one of the PAs in the room, "What's the matter?" I thought he's all fixed. She goes, "It's okay, he's bleeding out. They'll take care of it." So back into the operating room for about 3 to 3.5 hours. I should ask Dr. Friedel or Dr. Wilson. I'm assuming, I was told that when he opened me up again, I guess he purged as much of the heparin out of the system. So that was, I guess, 7 to get all fixed, and another 3.5 to take care of the bleed out. Monitors went off again. I guess I lost so much blood that I needed a transfusion. They took care of that. And I'm sure everybody's got, remembers what it was for them. I'll just share one traumatic one with you. I know I'm just 66, but I've heard enough times from people that have had, the open heart or some type of heart surgery that you know, that they come in the next day and they want you to walk. That was the first thing that got my attention, because after, it took me 2.5 days to wake up. And I remember the first morning I woke up, the nurse, the PA was there and said, "Hey, good morning." And, you know, my name was on the board like the nurses do, but she said, "You're the miracle guy." I said, "Huh?" She said to me, "Hey, I'm going to tell you 2 things. One, you haven't eaten in 2 weeks, so pick one thing off of that tray and find something that tastes good, and you need to eat that. And then I'll be back in 20 minutes and we'll take a walk." I want to tell you what, when I heard that, I hit the buzzer on my bed, and I can't make this up. I said, "I'm not in here for a sprained ankle, and I didn't get stitches in my hand." I said, "I think they just put my heart back together." She goes, "Like I said, have something to eat off the tray, and I will." And she was back in 20 minutes. But I'm going to tell you what, I could be up here for an hour telling you stuff. I just want to spend a little bit of time personally thanking Dr. Wilson, Dr. Fidel. I wish Dr. Flores was here, because it was actually Dr. Flores and Dr. Fidel that stabilized me and got me on my first life flight, or I wouldn't be standing here telling you this. The only other thing, the other people that I would like to thank is everybody in red, Kathy, the CATH team, just anybody to do with Meadville Medical. I've added an M to that acronym. It's MMC, but I've added another M. I'm the miracle from Meadville Medical Center, so thanks.
Yeah, what he didn't tell you is he was actually bringing his mother to an appointment upstairs in our building, and his mother made him stop into our office because he didn't look well. So the only reason he's here is because he was bringing his mother to a medical appointment. Remarkable story. I agree with what Dr. Friedel said. I've never seen anything like it. He blew out the septum in between his 2 chambers, and both lower chambers of his heart had holes in them. I've never seen it, anything like that. So anyway, he's here. And I just want to reiterate a couple things. Number one, I failed to mention, you know, we don't work alone. The emergency room, 2 North, ICU, you know, all the facets of the hospital, nuclear medicine, everything. I think we just work as such a nice, close-knit team. I think it's really important to point that out, because they've touched all the people that have been here through the hospital system, our office staff, you name it. I think that it's just a really good team, and I've not felt that before either. I want to echo what Jeff said. I mean, this is a team that's second to none to me here. I also want to say that even though not all of us, including myself, have a dramatic story like that, we're all in the same boat. We have coronary problems, we have cardiac problems, we have cardiomyopathy, we have pacemakers, we have defibrillators. We're all here together, and that's why we're here. And I think that it's remarkable that you guys came out and the turnout, and we'll do it again next year. So we're going to have a little raffle right now. Just to, Anika has to talk. I forgot. You're right on my list, Anika. So I'm sorry. It's a good thing she spoke up there. Were you going to come up and wrestle me? So Anika is going to speak on behalf of the cardiac team here. Anika's in charge of the cath lab. You know a bunch of the characters coming up here. I didn't know who was going to come up, but Anika used to work solely in the cath lab, and now she's sort of in charge of the cath lab, but has been thrown back into the cath lab again and works with us, not quite on a daily basis, but takes call and whatnot. So I'll turn it over to her.
Thanks. Lucky go lucky. Nate. My name is on the agenda, he just didn't read it. So I just wanted to take a few minutes. I'm one of the nurses that work in the cath lab, and along with everybody here in red, some of you didn't come up like you were supposed to. But we, as a group of nurses, physician's assistants, office staff, x-ray techs, just wanted to take a moment to thank Dr. Wilson for everything that he's done for us, as well as the community as a whole. When Dr. Wilson came here 6 years ago, it didn't take us long to realize that we had truly hit the jackpot. It was very evident that he had a deep passion for his job and an even greater passion for taking care of his patients. Not only were we blessed with a physician with a humongous long list of credentials and an endless knowledge base, but we soon found out that we had gained a teacher, a mentor, and a friend. He has poured countless hours into educating all of us, not just the cath lab, but his physician's assistants, office staff, nurses on the floor, and I can't even tell you how many medical students, residents, and interns we have had come through our department. And it's because of that, because of his teaching, that he has passed that passion on to all of us. And I think if you would ask any of these people standing here in red about their job, they'll tell you they have the best job in the world. So fast forward about 6 years, and it's amazing to look back and see how far this program has come. And we've met so many amazing people, and a lot of our patients have become our friends. Being able to say that we're part of a program that has helped to save so many lives is an amazing feeling, but it's what healthcare is about. It's why we do what we do. But this program wouldn't even exist if it weren't for that one decision 6 years ago that Dr. Wilson and his wife Kelly made to come to Meadville. So thank you. We are so grateful for that decision. Finally, as Dr. Wilson said, our most recent blessing and exciting news is that Dr. Friedel has joined us 2 days a week, which has also been amazing. It's like deja vu. We have hit the jackpot all over again. We're so glad that you're here. So thank you, Dr. Friedel, for coming to join us. It's such a pleasure to have another doctor that shares that passion that we all do, and we're excited about our future with the cardiology department. So that's pretty much it. Thank all of you for coming. This really is what this is all about. It's our patients. It's why we're here. And we all look forward to this event every year because we like to see you guys here and not in the hospital. So thanks so much for coming. I'm going to turn it back over to Dr. Wilson. He and Kelly have a raffle to do, and good luck with those little tickets you got. Thanks.
I must have blocked that out for some reason. Thank you. I appreciate it. I want to thank you again for coming, and appreciate us being a good, strong community here. I'm here for you. You're here for us. These guys are here for everybody, and I just want to give another thanks to all the people back there, because they're really what makes this work. So thanks again for coming.